from the American Academy of Pediatrics.
There's been a lot of talk about vaccines in the news lately, and with that comes a lot of questions and misinformation. As a pediatrician, I'm hearing from more and more parents who aren't sure what to believe. Thankfully, my guests today are here to clear things up.
I think as pediatricians, we do have really good relationships that are built on trust and respect. And for families who are out there that don't know us, I would say if there was a concern about vaccines, pediatricians would be the first to sound the alarm.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I'm a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, I have with me Drs. Ari Brown and Julie Boom. Ari is an Austin-based pediatrician and author of Baby 411, and Julie is a professor of pediatrics at Baylor College of Medicine. Welcome.
Thanks for having us.
Julie, I'll go to you first. We've recently reached a grim milestone with the measles outbreak. There have now been more cases in 2025 than in any other year since measles was declared eliminated in the U.S. in 2000. This has unfortunately continued to evolve. Can you give us the latest update on the measles outbreak, Julie?
Yeah, unfortunately, we've had over 1,300 persons diagnosed with measles, and this is more than we've really had in decades. About a third of those persons are less than age 5 years. Another third are school age and teenagers, and another third are adults. And it's really important that everyone knows over 90% of these people are simply unvaccinated. And of all the 1,300 people who've gotten sick, about 10 to 20% have ended up in the hospital, depending on the age group. So as much as you may have heard maybe from a grandparent who got measles back in the early 1950s that, hey, it's not that big of a deal, it really is. Even back then, we would have about 500 children a year who died from measles. And even now, we can lose 1 to 3 people per 1,000 who get measles. So it is very serious.
Extremely serious. And we have unfortunately already seen cases of children dying from this. And of course, every child is a child too many. Now, Julie, why has this outbreak been so hard to contain?
Well, first, you have to know that measles is super contagious. So let me relate this to something maybe you're more familiar with, like the flu. If an infected person with the flu walks into a room of people who are not protected or vaccinated against the flu, they'll make 1 to 2 people sick. Compared to measles, when that infected person with measles walks into a room, they will make 18 people sick. So it's crazy contagious. And measles also stays in the air. So when someone sneezes or coughs, they create aerosols and droplets, and those viral particles actually stay in the air for up to 2 hours, even after that person leaves the room. So you could unsuspecting walk into a room, think no one was there, breathe that air, and actually get sick. So it's really super contagious. You can also spread the measles before you even come down with the rash. So 2 to 4 days before you get the rash, you may initially have no symptoms. Most people develop a prodrome, and those are non-specific symptoms like runny nose, cough. You can get fever, red eyes, but lots of viruses do that. So you may not really know it's the measles, and your pediatrician may not realize it's the measles until you get the characteristic rash.
Yeah, it all makes it so hard, right? It's like the perfect combination that makes the virus and the illness as a whole just so contagious. Ari, I wonder what you have seen.
Well, both of us live in Texas, by the way. I'm in Austin and Julie's in Houston, and the main outbreak is actually in West Texas. But the interesting thing that I've seen is that some of these cases have actually traveled from Gaines County to peripheral areas of Austin. And the good news is that it has not spread here. And so I think it's important to emphasize that highly vaccinated communities have something called community immunity, meaning we have a highly vaccinated population here. And so we're able to kind of have a shield and protect each other because of that. And so it really is happening in pockets of under-vaccinated communities. And so that lower immunization rate leaves people more susceptible and easier to spread. And the unfortunate part is that not only does it spread to people who are unvaccinated by choice, but there are vulnerable children, babies under a year of age, who are too young to be vaccinated. And that's something that we really need to be super aware of when it comes to community immunity and why it's so important that all of us maintain high protection.
Yeah, and so important that we get those levels of immunization up in our communities, right? Because of children who are too young, because of other vulnerable communities, in addition to the complication rates that Julie was telling us about, of course. Unfortunately, measles isn't the only illness that is making a comeback right now. There have been more than 10,000 whooping cough cases in the U.S. this year. Ari, what is causing this surge, and what can parents do to protect their children?
Right. So whooping cough really also requires a high level of protection. But one of the other things that we know is that with the vaccine, the immunity does wane over time. And that is actually different than the measles vaccine, which has a very high lifelong protection rate. But when it comes to the whooping cough vaccine, before our vaccine came out in 1948, we used to see about 200,000 cases a year. And now we see about 10,000 cases a year. And as of July, we've seen 15,000 cases this year already. So we know that this is a troublesome number and something that we're really cautious about. One of the reasons is, yes, there has been some vaccine hesitancy. Also, during the pandemic, some of our kids missed out on their booster shots, which they need to maintain protection. And the other thing, and this is very transparent, is that we made a conscious choice in the United States to move to a safer vaccine that has fewer side effects. And so the early version of the wholesale whooping cough vaccine, it was more protective, but it also caused more side effects, and kids had really high fevers with it. And so we made a conscious decision to opt for a vaccine that is kinder and gentler, but we also know that it has less protection for the long haul. And so we know that immunity doesn't last and we need to give boosters. And it's super important for families to realize, because I always have parents coming in at the 2-month well check and they're so excited that they're getting their first set of shots. And they're like, oh, good, the baby's getting the whooping cough shot. And I always tell people, well, it's really those first 3 doses that get you to optimal protection initially. And so we're really just priming the immune system on that first dose. And your baby needs to get them at 2, 4, and 6 months for really effective protection. We want to protect them as soon as it's safe and effective to do so, but you have to kind of get that series underway to be able to protect them by 6 months of life. And that's why it's important to cocoon the baby and have everyone around them protect them.
Yeah. And I have to tell you, I had to see little babies with whooping cough in my training. It is not an illness that I wish on anyone, but definitely not on little babies. I mean, it's just a heartbreaking illness to see. Julie, I wonder if you can tell us more about what that looks like in the nursery and how we approach these cases.
Yeah, and these infants especially can get super sick with pertussis. You can just suddenly stop breathing, and it's really hard. Sometimes it's not even recognized that it's pertussis. Parents will think, oh, it's just a little virus with a really bad cough, and then it can put your baby into the ICU. And it can be very serious. I actually round on the postpartum floors at Texas Children's on an intermittent basis, and I'll talk to the mom who's just delivered, and I'll ask her what vaccines they got during pregnancy. And it's really common that moms report that they did get a Tdap vaccine. So they are boosting their own immunity to protect their baby. And then I'll look around to the other folks in the postpartum room, and it may be the baby's father, it could be other caregivers like a grandparent figure, and I'll ask them, and then I get a much more varied response. Maybe, maybe not, they got it or they were thinking about doing it. And I encourage them, when they're taking that baby home from the hospital, everybody stops at their local Walgreens, CVS, et cetera, to go get a vaccine, because we have to make sure that everyone is protected so that baby can't get it from anybody.
Yeah, I made it a rule. You cannot meet my baby until you've waited 2 weeks after you got your Tdap booster. So if you wanted to meet my baby right after he was born, you sort of had to do it in advance. And if you didn't do it in advance, unfortunately, you don't get to meet my baby until you do it. And honestly, my family was super on board, thankfully. But I know that for some families, it's a bit of a conversation. Now, you both know that there's been a big shakeup at the Advisory Committee on Immunization Practices, or ACIP. This is the group at the CDC that makes vaccine recommendations on behalf of the U.S. government. Some of the new members are critical of vaccines and have a history of spreading misinformation. Ari, I'll go to you. How does this impact families, and where should parents go for reliable information about what vaccines their children should have?
Well, from a professional standpoint, I would say that ACIP previously was a very reliable source for reviewing the data and making recommendations. And unfortunately, now it's really not a reliable source. But the good news is the American Academy of Pediatrics has been around for 95 years, and we're still kicking. And we are always there to provide a recommended vaccination schedule. And it is a trusted source for fact-based guidelines on immunizations, as well as other child health issues. And the AAP is going to continue providing a recommended vaccination schedule. So I think we can all look forward to AAP continuing to carry the torch for kids.
Yeah. Julie, how are you talking to your patients about this?
Well, it can be confusing at first, but I think it's important to realize that the AAP has had an immunization schedule for decades. And so did CDC, so did the American Academy of Family Physicians. But as more vaccines were added to the schedule, because we're able to keep kids healthier and prevent them from having these serious illnesses, it did become more confusing. So in 1995, those groups got together and created a harmonized immunization schedule. And because of the recent changes, what's going to happen now is those immunization schedules will no longer be harmonized. But I think everyone should know that the AAP is there, and there are other national groups that are really determined to make sure that we have an immunization schedule that really emphasizes safety, effectiveness, to make sure that all children are protected.
And Julie, speaking of the very first thing that is no longer harmonized, the federal government has changed its recommendation for COVID-19 vaccine for pregnant women and healthy children. What does this mean for how easy it will be for people to get this vaccine if they want it?
Well, that may really be changing. So at the end of May, an announcement was made that COVID vaccine was no longer recommended for children and pregnant women. And that announcement was really not based in the science at all. So during the pandemic, we were all focused really on adults because adults were so profoundly impacted by COVID. We lost 1 in 300 people to COVID, and it's just terrifically sad. But children were impacted also. And throughout the pandemic, the AAP actually kept track of pediatric deaths, and we had over 1,000 children die from COVID. So we do know that children are impacted, and it can be a very serious illness. Early in the pandemic, it was really clear that pregnant women were being impacted really negatively. Pregnant women were more likely to end up in the hospital, maybe need assistance breathing or to be intubated. The COVID could make it more likely that they have pregnancy-related hypertension or preeclampsia or even develop eclampsia. So this was very serious. The American College of Obstetrics and Gynecology, or ACOG, they recognized during the pandemic how important vaccination was. And despite the national change, they are still recommending COVID vaccine for all pregnant women. And we also know that children who are less than 6 months of age, they are likely to get hospitalized just as much as our elderly people are. So if a pregnant mom gets vaccinated, she's not only protecting herself, she's also offering protection to her newborn infant. So super important. What really concerns me is insurance going to pay for this? And if it's no longer recommended, then we may see that different insurance companies change their practices. And for a mom to get vaccinated, they may end up having to pay out of pocket.
I have been super, outspoken. I did choose to receive the COVID-19 vaccine while pregnant, and I'm so glad that I did. I delivered at term. My baby was born very healthy, despite the fact that I was working in the healthcare system during the COVID-19 pandemic, right? I was one of those moms with a pandemic baby. And to be super clear, the major medical organizations are still recommending this vaccine for pregnant women and for children. We just have the first discrepancy that we may see from what the government is now recommending. Now, Ari, my question to you is this a loss of medical freedom here?
Well, frankly, yes, because, and this is personal opinion, I feel like parents and pregnant people should be able to get the vaccine for themselves and for their children should they choose to. So I think we need to be all very aware that this decision is not coming from a place of medical recommendations, and we need to be vocal about it and say, this is something that we want, and it should be covered by insurance because it is medically indicated.
Yeah, and we want to be able to make that choice with our physician, right? All right, there has been, as you know, a lot of news coverage about an ingredient in some versions of the flu shot called thimerosal. What is thimerosal and why was it in vaccines?
I mean, I have to say, and I've been in practice for 30 years now, this is like a remake of an old movie that was already bad the first time. So it never should have even had a second chance. But here's what you need to know is thimerosal was a preservative that was added to vaccines to actually prevent bacterial contamination of the vial of vaccines so that you didn't end up having an abscess or some horrible infection from getting a vaccine, right? And while it's all over the news recently, it is not in your childhood vaccines because it hasn't been in the past 20 years. So this is why I say it's just a bad remake. It was removed from all childhood vaccines in 2001, even though there was never any evidence of harm. But activists who pushed for this were concerned about autism. And I will say, just kind of looking at this from a scientific standpoint, our autism rates have continued to climb for the past 25 years with thimerosal-free vaccines. So we now have an entire generation of proof to say this was not the root cause of rising autism rates. But the only vaccine that actually continued to include this preservative was a multi-dose flu vaccine used in about 4% of the entire flu vaccine supply, and that was mostly given to adults. So I can ease your mind that although this was never an issue, it's still not an issue, and it is not in your child's vaccine. So you don't have to ask your pediatrician if they're using thimerosal-free vaccines. We do not have any vaccines to offer that have thimerosal in them.
I love how clear you are about this, and you can tell that you've talked about this many times.
Right?
Yes. Now, you won't be surprised, both of you. I've been seeing this in my practice. I've been hearing it from colleagues, other pediatricians, who say that the questions the parents are bringing into their visits have become more intense. There's more uncertainty and anxiety about immunizations as a result of the disinformation that they're seeing. And this means that pediatricians are spending more time addressing fears that may not be based in reality instead of talking with families about their child's nutrition or how to support them in school or their mental health. I'd like to hear from each of you about how you are responding to this. I just wonder, how are you talking to families about vaccines? What do you share with parents to help them feel confident with vaccines? And Julie, I'll go to you first.
In the greater Houston area, we are definitely seeing an uptick in families who are coming in. They've got vaccine questions, more vaccine concerns, really wondering what to do. And in our prenatal classes, our prenatal teachers are saying, parents want to do this research themselves. So I do think it's super important that parents go to reputable websites, the American Academy of Pediatrics, another one, Voices for Vaccines, another one, Vaccinate Your Family. You may not feel comfortable giving everything that's going on nationally to go a governmental website. And I really encourage you to go to these other websites, do your research, or go to trusted hospitals near you. So in the Houston area, we have Texas Children's Hospital, and we've actually been developing materials from our hospital so people can feel that local trust, whether it's one-pagers about the importance of measles or pertussis. We've got that information out there. So we've been trying to educate folks, even on vaccines for older children, like the HPV vaccine. We've started sending out 1-minute video messages from the pediatrician to their patients, really telling them their information about it so they can hear it from their pediatrician and not just learn misinformation from the internet.
All right, how are you talking about this?
At the end of the day, what I feel about these conversations and, kind of healthcare communications is that parents today don't feel like they know who to trust, right? They are uncertain about who to trust. And we know that it boils down to, your pediatrician who truly has your child's best interest at heart. And we're comparing that to some rando on your social media feed who's telling you something, right? And so it's very easy for us to say who the better choice is, because as pediatricians, we choose this work because it's our calling and we are on a mission to advocate and care for kids. And I will say, very personal space, my families in my practice, they know this. And I think as pediatricians, we do have really good relationships that are built on trust and respect. And for families who are out there that don't know us, I would say if there was a concern about vaccines, pediatricians would be the first to sound the alarm. Okay. But specifically what I do with my families is I listen. And that seems pretty easy, right? But parents really just want to be heard and they want to be reassured and they want to be reassured by somebody they trust. And I feel fortunate that families feel like they can trust me. But I also ask parents and families that they listen also, and they listen to us because we've seen these diseases. And so Julie and I actually go way back, but we did our pediatric residencies together and just went to our 30-year reunion and reminisced about some really ugly nights where we were doing spinal taps on sick, feverish babies back in the day. And we would routinely see those children with now vaccine-preventable meningitis, right? We don't want to go back to those days. And I would say that we live in kind of a golden era these past few decades, thanks to vaccines. And parents today really don't realize how good they have it because they don't have to worry about these diseases that they don't see anymore. And, the world is round. Germs are real. They cause disease. So I think we can all agree with that. And we need to remember that when we think about these vaccine conversations.
I so appreciate that, Ari, and that perspective. As we come to the end of our show, I like to end our episode with what we call a parenting prescription. So when it comes to vaccines, especially in the context of measles, what is one thing you want all parents to know? And I'll go to you first, Julie.
I want parents to know that they should trust their pediatrician about vaccine advice, just as they do when their child has a fever, an earache, and they listen to what, the pediatrician diagnoses their child with and implements that treatment plan. Do the same thing about vaccines. I treat all my patients just as I would my own children. I recommend the very same thing. So please know that we treat our patients just like we do our own children and families. And so please trust us. Please listen to our recommendations.
Ari?
Yeah. So pediatricians, many of us are parents too, and we get it. And we vaccinate ourselves and we vaccinate our kids without hesitation. When parents ask me what the right answer is, that's probably the best information I can give them is I vaccinate myself and I vaccinate my own kids.
Yeah. And I wouldn't recommend anything for your child that I don't recommend for my own. Thank you both so much for this conversation today.
Thank you, Edith.
Thanks so much.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens-Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.